All right, hello everyone. My name is Brecken Vasquez, and this is going to be presentation two, exercise programming for individuals with sarcopenia. Now, before we get started, we're kind of just touch on a basic outline of what this presentation is going to look like. So first, we're going to touch on some introduction and background information, defining sarcopenia and its global impact, and then summarizing some of the key physiological causes such as type 2 muscle fiber loss, inflammation, and hormonal decline. We're going to dive into some of the evidence-based benefits of exercise, including short and long term. Then we're going to touch on some of the risks and consequences of improperly prescribed exercise. Then we're going to touch on a case study, an exercise prescription, and then some practical applications for professionals, some resources for professionals and clients, and then finally a conclusion. Now, some learning objectives for this presentation. We're going to want to be able to identify the short and long-term physiological and functional benefits of properly prescribed exercise, recognize the potential risks and consequences of improperly prescribed exercise, develop an individualized evidence-based prescription tailored to the need and goals of older adults with sarcopenia. And then we're going to want to be able to apply the practical coaching and program design strategies for safe, progressive training with this population, and then access reliable, professional, and client resources for ongoing education, training support, and exercise adherence. So, kind of an introduction and background on sarcopenia. So, what is sarcopenia? It's going to be the progressive loss of muscle mass, strength, and function as we age. The prevalence of it is 10% of adults over the age of 60, and then 30% of adults over the age of 80 years old. Now, why is this important? It's going to lead to frailty, falls, and an overall loss of independence in those individuals. Some more background information. So, some of the physiological mechanisms are going to be a loss of type 2 muscle fibers, so 20 to 50% smaller and 30 to 40% fewer by the age of 80. We're going to see rapid hormonal decline, so reductions in testosterone, growth hormone, and IGF-1, all decreasing protein synthesis. We're going to reduce motor unit firing, so a decreased neural drive and coordination. Then we're going to have overall chronic systemic inflammation with an increase in cytokines IL-6, TNF alpha, all promoting catabolism. And then this is a diagram right here, kind of showing how the age-related muscular atrophy is going to affect individuals with sarcopenia. So we're going to see a loss in skeletal muscle mass and contractile strength, leading to skeletal muscle fiber aging, leading to a decrease in size and number of contractile fibers, leading to preferential wasting of type 2 muscle fibers, causing a decrease in those fast, so type 2A and type 2X, and increase in the slow type 1 muscle fibers. And then we're going to see an aged skeletal muscle, which is going to lead to frailty and a bunch of other physiological declines, reducing physical fitness, diminishing our quality of life, and overall losing independence for that individual. Now, some more background that we're going to see or that we're going to talk about. So, some consequences of inactivity: 3 to 5% lean mass loss per week during bed rest, a 35% slower gait speed, and 2 times higher fall risk in sarcopenic adults, 3.6 higher mortality rate, and 25 to 30% lower quality of life. The treatment status for sarcopenia: there's no current approved FDA medications for sarcopenia currently, but what we have found is that resistance training and nutrition are going to remain the most effective interventions. Now, some more background. So, over here to the left, we're going to see three different quadricep muscles from three different individuals. So, we have a 40-year-old triathlete, a 74-year-old sedentary man, and then a 70-year-old triathlete. In the first one right here, we can see that 40-year-old triathlete has very healthy, lean tissue with very little adipose tissue surrounding it. And then as we move on to the 74-year-old sedentary man, we can see a lot of muscular atrophy, not much healthy muscle tissue, and a lot of adipose tissue surrounding that quadricep muscle. And then as we move on to the 70-year-old triathlete, so quite an active individual, we can see that their quad and the quad of the 40-year-old triathlete are almost completely identical. So a lot of healthy muscle tissue right here, very little adipose tissue, kind of showing that we can maintain that healthy lean tissue even as we age if we stay active. And then over here is kind of just depicting the different lifestyle and then physiological, more cellular effects of sarcopenia. So when we see a decrease in muscle health, we're going to see a decrease in resting energy expenditure, decreased insulin sensitivity, decreased muscle mass and strength, decreased physical abilities, an increase in the risk of falls, increase in the risk of fractures, increased tiredness and muscular pain, and an increase in risk of hospitalization when we have sarcopenia. And then we're going to see hormonal changes, so an increase in ROS, decrease in growth hormone, decrease in IGF-1, decrease in testosterone, decrease in estrogen. Satellite cells are going to diminish. We're going to be in a chronic inflammatory state. Lifestyle factors are going to diminish, decline in neural drive, malnutrition, hypovitaminosis, and then myokine disruption with an increase in myostatin, and then mitochondrial dysfunction with an increase in reactive oxygen species and a decrease in biogenesis. Now, as we kind of wrap up the background here and start getting into the presentation, just a quick quote to kind of think about as we continue. So, sarcopenia is not an inevitable part of aging. It is a preventable loss of strength, vitality, and independence. So, just kind of something to think about as we continue through this presentation. All right, now we're going to dive into some of the evidence-based short and long-term benefits of exercise. So, some of these short-term benefits that we are going to see are improved neuromuscular activation and motor unit recruitment. And then we're also going to see an increased muscle protein synthesis and cross-sectional area. Now, Papadopoulou 2020 conducted a systematic review of existing literature on older adults, touching on the topics of prevalence, etiology, prevention, and treatment for sarcopenia. Now, what they found was that sarcopenia prevalence is highly variable, ranging from 5% to 50% depending on age, gender, population, and the setting. And what the review found was that there are major contributing mechanisms such as the loss of type 2 muscle fibers and hormonal changes um, that are going to be affected when people have sarcopenia. But the biggest thing that they took out of this review was that physical activity, especially resistance training and proper nutrition, are the most studied and promising interventions for preventing sarcopenia. Um, and then we're also going to see enhanced balance and mobility with 35% improvement in gait speed. And then this diagram right here is from that Papadopoulou article, and it's showing a bunch of different interventions, the regimens, and then the observed outcomes of those interventions from the studies that were analyzed in that review. And pretty much what it's showing is that resistance training has the greatest effect on muscle quality, and the prevention of sarcopenia. So the regimen right here, and then some of the observed outcomes that we can see. Now, some of the more long-term benefits of exercise. So muscle mass preservation. Resistance training can reduce age-related muscle mass by 30 to 50%. We're going to see reduced fall risk with up to 2 times fewer falls in trained versus inactive older adults. Improved metabolic health, so increased insulin sensitivity and mitochondrial function. Now, this same article, Landy, was a narrative review paper, and the purpose of it was to examine the biological mechanisms leaking sarcopenia and physical frailty. And the authors synthesized findings from clinical, epidemiological, and mechanistic studies. And this was all on age-related skeletal muscle changes such as mass, strength, and quality, hormonal, inflammatory, and neural mechanisms contributing to sarcopenia and frailty, and then the role of physical exercise, protein intake, and vitamin D intake in maintaining muscle function in older results. And what they found was that sarcopenia was the biological basis of physical frailty. And some of the pathophysiological mechanisms they identified were endocrine decline, so reduced testosterone, growth hormone, chronic inflammation, mitochondrial dysfunction, neuromuscular degeneration, and then just an overall sedentary lifestyle, which is going to exacerbate that muscle wasting and functional decline. Now, some exercise and nutritional interventions that they proposed were resistance training was identified as the most effective non-pharmacologic therapy for preventing or reversing physical frailty. Exercise is going to improve muscle protein synthesis, excuse me, via the mTOR activation. It's going to improve mitochondrial function and motor unit recruitment. And then overall physical performance and independence is going to be improved. Now, some of the psychosocial benefits also involved are we're going to see improved confidence, independence, and quality of life. And then this image over here is pretty much showing how resistance training and aerobic training, how two different training methodologies, kind of affect some different physiological mechanisms involved with exercise. Now, as we kind of dive into nutrition as a co-treatment for combating sarcopenia, um, we're going to see that protein recommendations are going to be 1.2 to 1.5 grams per kilogram per day. We're going to want to spread that protein evenly throughout the day, and then we're going to want to ensure adequate vitamin D and micronutrients are being consumed. Now, Robinson et al. Was a review article conducted by an expert working group. The authors systematically collected and synthesized existing observational studies and interventions that examined associations between nutrition and outcomes of muscle mass, strength, and physical performance. And what they found was that there is substantial observational evidence linking better nutrition with higher muscle mass, better strength, and improved physical performance in older adults. So, combining nutrition and exercise is going to elicit the best outcome for presenting sarcopenia. Now, this is a graph from that same study, and it is the mean mixed muscle protein fractional synthetic rate, or FSR, after protein ingestion in young and older men at rest and after exercise based on phenylalanine enrichment. So pretty much what this is telling us is if we have adequate nutritional consumption of protein, then we can maintain that high muscle protein synthesis even as we age, as we can see right here with the gray, as the older individual has even higher FSR rates as opposed to the younger individual. So adequate protein consumption is going to help us prevent sarcopenia as we age and have high muscle protein synthesis. So now exercise as medicine. So some of the recommendations that we're going to see for exercise to prevent sarcopenia are 2 to 3 days per week, 2 to 3 sets per week, 8 to 12 reps at 60 to 80% of one rep max. We're going to want to see progressive overload to improve muscle function and independence. We're going to want to combine resistance training, balance, and mobility for frail individuals. And then this image is pretty much just showing the different benefits of exercise and how it can help us combat sarcopenia and the physiological mechanism that we're going to see. So, improved body comp, improved blood pressure, improved blood glucose and insulin sensitivity, improved physical function and mobility, greater oxidative capacity, increased muscle mass and strength, improved immune system function, and improved blood lipid profile and vascular function. Now, exercise as medicine. So, an article I wanted to touch on was Kumar et al. Conducted in 2022. This was a systematic review of 27 studies, 5,000 participants over the age of 60 years old. It focused on exercise prescription variables for sarcopenic adults and recorded frequency, intensity, time, type, progression, and adverse events. Now, what this article found was that resistance training was the core intervention for preventing sarcopenia. The frequency that they found was most effective was 1 to 5 sessions per week at an intensity of 20 to 80% 1 RM or RPE 6 to 14 with a duration of 20 to 75 minutes per session. And what they found was that was going to increase muscle mass and strength across all trials. Now, they also found that aerobic training had benefit too. So, at 50 to 7% of heart rate max, 60 to 30 minutes, 2 to 5 days per week, they found an increase in endurance and overall metabolic health. And then balance and flexibility was also incorporated at 2 to 3 sessions per week, 50 to 30 minutes, decreasing falls and increasing mobility. Now we're going to dive into a case study of an individual. So our client is going to be Martha. She's going to be 72 years old, female who recently retired, is moderately active, reports decreased leg strength and slower walking speed. Her medical history is controlled hypertension, osteopenia, and she has no cardiac limitations. The assessment tools we are going to use are going to be the grip strength test, gait speed, chair stand test, and DEXA scan for lean mass. Now, why do we want to use all these different assessment tools? So for hand grip, it's going to measure upper body muscle strength. The expected value that we hope to see for Martha's age group, 70 to 79, is going to be 25 to 35 kilograms. The sarcopenic cutoff is going to be less than 20 kilograms, being indicating probable sarcopenia. And then Martha's result was 18.5 kilograms, which is below the cutoff, indicating she has low muscle strength. Next assessment tool, gait speed, measures physical performance and mobility. Expected value for Martha's age range is greater than 1.0 to 1.2 meters per second. Sarcopenic cutoff is less than zero point 0.8 meters per second, indicating poor performance. Martha's unfortunately was 0.74, so she was below that threshold, reducing mobility, indicating she has reduced mobility and a higher fall risk rate. Now we have the chair to stand test, indicating lower or measuring lower body strength and functional power. The expected value that we hope to see is greater than 12 or less than 12.6 seconds. Sarcopenic cutoff being greater than 15 seconds. Martha was 16.8 seconds, so she was slower than normal, indicating weak lower limbs. Then finally, the DEXA scan measuring muscle mass quantity, the expected value that we hope to see for age range 6.0 kilograms per meter squared. Sarcopenic cutoff less than 5.5 kilograms per meter squared, indicating low muscle mass. Martha was 5.2. She was below that threshold, confirming that she has onset sarcopenia. Now, a resistance training program that we could incorporate for Martha to combat sarcopenia. The frequency that we're going to want to see is 2 to 3 times per week at an intensity of 60 to 80% of that 1 RM, so moderate to high intensity. The type of movements we want to see are multi-joint resistance exercises such as squats, rows, leg presses, chest press, so compound movements incorporating a lot of joints. The time we're going to want to see 45 to 60-minute sessions. And for progressions, we're going to want to see gradual overload every 2 to 4 weeks, so slowly progressing. Now, aerobic training obviously has benefits as well. So, some aerobic training programs we can implement. The frequency is going to be 35 days per week at an intensity of 57% heart rate max or RPE 11 to 13. So, light to somewhat hard. We're going to want to see the type be low impact walking, such as treadmills or outdoors. Then the time is going to be 20 to 40-minute sessions with a progression of gradually increasing duration and then eventually intensity. Now, Martha also had bad balance and mobility, so we want to incorporate a balance/mobility program as well. So the frequency, 2 to 3 days per week at an intensity of mild to a moderate challenge for that individual. The type is going to of exercise that we're going to see are going to be tandem stance, single leg, heel to toe walking, semi-tandem on foam pad, and then some yoga for increased mobility. The time, 15 to 25 minutes. Progressions are going to be gradual increase in duration and then intensity as well. Now, the expected outcomes that we hope to see from this program are an increase in muscle strength, increase in mobility, decrease in fall risk, and an increase in confidence in activities of daily living. Now, some practical applications for professionals. They're going to want to emphasize individualized assessment, including strength, balance, cognition, and comorbidities. They're going to want to prioritize resistance and physical functional training over endurance-only programs. They're going to want to include power-based movements such as sit to stand, step ups for type 2 fiber preservation. And then they're also going to want to monitor fatigue, joint stress, and recovery time. And then older adults may need longer recovery as opposed to their younger counterparts. They're going to want to encourage social group exercise to enhance adherence and motivation for those individuals. And then use validated tools such as the EWG SOP diagnostic flow chart, which essentially is that chart that we saw diagnosing strength first and then muscle quantity, kind of as we go through the process of diagnosing sarcopenia. And the SARCAP questionnaire, which is pretty much just a 5-item questionnaire used by healthcare professionals, which is going to screen the loss of muscle mass and strength, assessing 5 key areas being strength, assistance with walking, rising from a chair, climbing stairs, and then falls. Now, some resources for professionals are going to be that EWG SOP2 guidelines, agent aging, the NIA exercise and physical activity toolkit for older adults, and then NSCA position stand exercise in aging populations. Some resources for clients, NIA National Institute on Aging Go for Life website is a great resource. ACSM Exercises Mesh is Medicine Initiative, and then the local Silver Sneakers and Community Wellness Program. Now, the agreement that we see across research is there's a strong consensus in that strength first diagnosis. So we want to diagnose strength and movement quality first before we diagnose actual muscle quantity. And then exercise and protein are going to be the most optimal. Early screening is going to be extremely essential for catching sarcopenia early and preventing it. And then there are some disagreements in the research due to diagnostic tools or protein dose methodology. Some future directions that we can hope to see. We need more randomized control trials combining exercise and nutrition. We need a broader, more diverse cohort between Western populations. And then, obviously, like we touched on before, integration of sarcopenia into primary care. Now, some concluding thoughts. Sarcopenia is preventable and partially reversible through structured exercise. Exercise is going to be the best medicine, as combining resistance training, balance work, and adequate nutrition is going to yield the overall best outcome for preventing it. And then early intervention can reduce falls, hospitalizations, and a loss of independence. And this is just the image depicting some healthy muscle fibers and then atrophied muscle fibers, showing that this is not where we want to be, right? We want to be nice and healthy and try to avoid this. Now, a concluding quote: Sarcopenia is not an inevitable part of aging. It is a call to move, nourish, and strengthen the body. And then here are my references. I appreciate you guys' time. Thank you.